Next speaker, Dr. Ahmad Al Sarkhi is the pediatric consultant in pediatric gastroenterology and hepatology, King Saud University. We'll talk about the autism and gastrointestinal disorder facts. Welcome, Dr. Ahmed.
شكرا. يعطيكم العافية. جالسين إلى الآن. أنا عارف it is really long time and long day. You are tired, but this is the last two talks. I think this is going to be a very important talks for, really they are practical and they change maybe your practice. I'm going to speak about a very important topic for those who are dealing with, who are practicing in general gastroenterology and general pediatrics. The autism and the autism spectrum disorder is actually increasing, and we are seeing almost daily new referrals for us for gastroenterology for autistic patients whom they think they have some GI disorder, and we need really to work them to rule it in or out, and at least to help those parents who are really getting tired from going everywhere. I'm going to cover initially what is the relationship between the gut and the autism. How come they come together? Why the GI get involved in this area? What is the epidemiology of the autism and the GI disorder symptoms they have? What is the effect on the autism itself on the nutritional status of those kids? And what is the role of the nutrition, especially the gluten-free, casein-free diet that is used by the families to treat those kids? So the topic is very important because it's increasing. In the early or mid-80s, they said it's around somewhere around 81 case of autism in the 2,500 case. Later on in the 2000, they said one case in every 150 case, and then one case in every 68. There was one report from Taif. They did a survey on 2,000 kids of primary school. They found one case in every 29 kids in the primary school. So this is the prevalence is increasing. Part of it is because the awareness has become more clear in the families and the health practitioners. In addition, the broadening criteria of the diagnosis of autism make the numbers even higher. Now, unfortunately, we don't have that much of good evidence around. The last guidelines has been made on 2008. At that time, there was not much of papers, and their conclusion that the evidence is really weak, and those recommendations in this paper were mainly based on an expert opinion. However, since then, the evidence really evolved too significantly. As you know, autism is a combination of three characteristics: the social impairment in the social interaction, in the communication, both verbal and non-verbal, and finally, impairment in the social imagination. This means they are having those repetitive kind of behaviors all the time. Initially, autism has been thought is a psychological disorder. However, later on, and now the literature speak about it's a multi-system disease that includes GI, CNS, immune system, and on the whole metabolism in the body. What is the exact pathogenesis is not really well known, but the big theory is about the leaky gut hypothesis, which is actually the gut behind IBD, IBS, celiac, NAFLD. All these conditions now start to be explained by what they call leaky gut hypothesis. So how this story started? It started in 1970. This is the first report that came that the autistic kids, they have some GI problems. On 1998, this is a landmark paper by Wakefield. He reported at that time a landmark paper on Lancet that showed an association between lymphonodular hyperplasia and colitis on some kids with developmental regression. He proposed and his team that there is a causal relationship between MMR vaccine and enhanced risk of autism through a GI mechanism. Now, he called it that time autistic enterocolitis. Now, this paper has made a big shift on the family behavior toward vaccination. Actually, some of the families, they stopped doing the vaccination for kids. Some, they start having this lawsuits against vaccination and companies. However, later on in 2010, this paper found to be really falsificated, the data, and the one who did it, Wakefield, has been, his medical license has been suspended in UK. And since then, this one, at least from the evidence-based medicine, there is no relationship between MMR and the autism and the GI and the autism. However, the story of GI involvement with the relationship with autism is still there till now. So what is the theory? The theory said that those autistic kids, they have some genetic background. It's not only one gene, actually there are multiple genes. They need to have some environmental factor as a second hit. This can be prenatal like maternal health during pregnancy, exposure to infection or toxins, can be perinatal through delivery, or postnatal like going to formula other than breastfeeding and receiving too much of antibiotics. So those two things, the genetics plus the environmental factor, will have some change on the normal flora inside the baby's body, so cause the dysbiosis. This will enhance or cause gut inflammation, and this is what will lead to leaky gut. Now the gut is leaky, so all the toxins will be easily going through the bloodstream, and then that cross the blood-brain barrier and go to brain and cause a significant, as an immune-mediated inflammatory reaction that cross to the brain and cause those behavioral symptoms. The same things, those toxic peptides, they cause the GI symptoms like the pain and screaming and all those behavioral symptoms. So this is the main theory behind this association. There is different symptoms has been reported in kids with autism. GERD, dysphagia, chronic diarrhea or constipation, eosinophilic esophagitis, and all this list that you see. Now, the prevalence is really not well known. If you read a subspecialty journal, they tell you, oh, the rate is very high. It's somewhere between 50 and 85. But when you read a community-based sample, actually the study showed there is no really big difference between autistic kids and normal kids in the general population. This is a study done on UK. They study over 11 years. They look for the kids born between 1988 and 1999. Over 11 years, they found 96 kids. And with autism, when they compare it to the normal kids, they found actually there is no difference in their symptoms compared to the autistic kids. I mean the GI symptoms. Another study. This was from the state, and they followed the patient over 18 years. They found when they look for overall, there is no difference between the two groups. I mean, they follow up at age 1, then 5, then 10, then 15, then 20. In general, there is no difference in the GI symptoms. However, they found that constipation and feeding issue, or like feeding selectivity or refusing feeding, is more common in the autistic kid. Now, you can observe that constipation and feeding disorder can be greatly a behavioral symptoms or behavioral reaction from the kids. This is a recent study actually found that autistic kids, they may have, those autistic with feeding disorder, especially dysphagia, they may have eosinophilic esophagitis. So if you have a child with feeding disorder, with autism and feeding disorder, you should not just say this is a behavioral. Maybe you need to rule out eosinophilic esophagitis in those kids. So in summary, for this part, the GI symptoms, yes, they occur in the autistic kids, but they are not more common than the general population. There is no conclusive evidence that there is a unique GI pathology in autistic kids. And finally, if you find the autistic patient with GI symptoms, he should be evaluated the same as the normal other kids. So what about the leaky gut syndrome? What is the evidence behind it? Well, basically, so what they do to measure the leaky gut is do something called lactulose mannitol excretion, urinary excretion ratio. They gave the child both lactulose and mannitol orally, and now lactulose is supposed to be not absorbed, mostly non-absorbable. Mannitol is mostly absorbable, and both of them, when they absorb in the body, they are inert sugars, so the body will not metabolize them. At the end, they will be excreted in the urine, and there's a special ratio there. usually the normal kids, they should have a normal ratio, but those who has leaky gut or those who have leaky gut, they will have abnormal ratio. Now, the early study that showed that there is an altered intestinal permeability was reported in the 1996, where they, like almost 45% of those kids that found by this test, they have a leaky gut. However, 60% they don't. Now, the new recent study did not really find that much of evidence, and still the evidence is controversial. This is a study. They looked for 90 kids of autistic kids. They compared them to 146 of their first relatives, and 146 as a normal adult control, and 64 as a normal kids control. They found that the impaired the altered intestinal permeability found on 36% of those autistic kids, 20% of their first degree relatives, however, was only 5% in normal adults and nothing in normal kids. So again, the most of the autistic kids, they don't have altered intestinal permeability. Another study, they compared the autism with another unique group, those with special educational needs, but they have the same matched age and IQ degrees. They found actually, again, there is no difference in the intestinal permeability between the two groups. And a final study, this is gone actually more invasive. They did a GI endoscopy for all these autistic kids, and they looked for the GI inflammation, GI permeability, and their disaccharide activity, and no difference between the autistic kids and those who are normal. So really the evidence around this area and the leaky gut autism is still really controversial. However, it is very clear that not all autistic kids, they have intestinal permeability. If they have, the symptoms does not correlate with the GI symptoms or even with the autistic symptoms. And when they do a fecal calprotectin to correlate between permeability and inflammation, again, there is no correlation. So again, the evidence is really wishy-washy. So what about the effect of the autism on the nutrition? Well, in fact, this is a study that done prospectively on 362 kids, and they looked to their nutrition. Actually, most of them, as you see on the left side, most of the autistic kids, they have normal growth. They have a healthy weight compared to being underweight or overweight. However, if you can see the last two graphs, if you combine the overweight and obesity, you find that those autistic kids, they are prone to have obesity because they are restrictive. They eat more of junk food, more of sweetie things. Their parents reward them with those junky food to have a good behavioral, and because of this decreased activity, and also because they use some medication that is actually stimulate their appetite. So they are really more prone toward overweight and obesity rather than being underweight. When they look for the subgroup, they found that the younger kids from 2 to 5 years, they are more prone to be overweight. However, the older kids, because of the restrictive diet, they become more underweight. Another study showing the same, they are more of a healthy weight rather than being underweight, but also they are more prone to have obesity and overweight. So if you find a child with a normal BMI, autistic child, this does not mean he doesn't have micronutrients. They may have normal weight, but they still have micronutrient deficiency because of the restrictive diet they are on. And this is a study showed that they are more deficient in vitamin A, vitamin D, and the calcium. So basically those kids, so summary for this slide, the autistic kids, they are having more normal weight, more normal body mass index compared to the healthy people, the healthy kids. However, they are more prone to have micronutrient deficiency. So the pediatrician should be aware of this, and they should monitor their weight and height when they see them in the clinic, and they should look for the micronutrient deficiency, and they refer to a nutritionist if needed. The last section is about the effect of the diet on the autistic symptoms, the behavioral symptoms. Now, it has been shown that, as you know, the family, they are really looking for anything to treat their kids. They are very, very feeling even guilty that their kid is suffering and cannot help. So they try different things. And the one of the common things they use the gluten-free, casein-free diet because there is some evidence it may work. So almost 25 to 50% of those kids they exposed at one stage to a casein-free, gluten-free, casein-free diet, and this is everywhere in over all the world. They found that the parents with higher education and the parents who with kids who have low function, they actually more prone to be on all those different alternative medicine. So why the gluten casein free? Why they came into the picture? This goes again to the old papers when they found those kids when they measured the anti-gliadin antibodies, their anti-gliadin antibodies were high. And actually, this was, as you know, anti-gliadin antibodies, they are not really specific for celiac disease. Later on, with the new studies, they didn't find actually when you do anti-TTG or anti-EMA on autistic kids, they don't really have a high risk of celiac. So the AGA, the anti-gliadin antibodies, doesn't have anything to do with the celiac disease. And actually, when they did correlation between intestinal permeability study and anti-gliadin antibodies or anti-TTG antibodies, they didn't find a correlation. However, the families still, they are trying to give their kids, because they are hoping, they don't have anything else to try, so they give them a trial of gluten-free, casein-free diet. They think, some of the family, they think it reduced their behavioral symptoms 25%. They think that they improved their GI symptoms by 50%. They think their concentration and attention is also improved when they are giving casein, gluten-free, casein-free. But again, if you see, the more, they don't have that much of significant effect. So this is 6 RCDs done so far to see the effect of gluten-free, casein-free diet on those kids. From those 6 studies, only 2 show significant difference in the behavioral symptoms, and the other 4 studies did not. This is an area no meta-analysis was done, so I think if someone interested from the fellows, this can be a good project for you doing a meta-analysis for casein-free, gluten-free diet on autistic kids. So basically, the evidence doesn't really support the use of casein-free, gluten-free diet in those kids. However, if you force by a mother or a father that they want to start their child on this diet, make sure, number 1, you rule out celiac. Number 2, rule out food allergy. If they are negative, tell them the chance they are going to benefit from this diet is very small, but also make sure they are going to receive a good follow-up with nutritionists, because this diet is really restrictive and very difficult. What about the microbiota? This is the whole thing started with changing the microbiota. And some interventions like using non-absorbable antibiotics or using probiotics or prebiotics.
2 minutes.
Or this is the last. Or doing a fecal transplantation. There is studies on autistic kids using those measures, but the evidence is really insufficient, and they find the results. Some are positive, some are negative. The sample size is not really large, and the effect is not that really significant. But the family, they want to try anything. Anything they see new, they go ahead and try it, because there is no other options for them. So this is the last slides to go and take home with this point. Number 1, autistic kids, they have the same GI disorder as the normal kids. Number 2, if they have a GI symptoms, they need to be evaluated the same as the normal kids. Number 3, they are more prone to micronutrients, so please be aware of this and look after it. And finally, there is no evidence really behind the gluten-free, casein-free diet. And maybe because the papers was not done very well to find this effect. But basically, this is the whole point I want you to remember at the end of the day. Thank you.
Thank you, Dr. Ahmed.